Um, Back with another YouTube video for my computer science 110 web final project topic. And my proposed topic was computer technology in medicine. Now, being a Morgan State University student, biology major, medicine has been a career interest from me personally for quite some time. I've had family who work in medical field, and that kind of spurred my interest of working with medicine, and quite frankly, most importantly, was the fact of like seeing how certain diseases and illnesses, how I feel like that outside of current medical alternatives and treatment options that are made available, I feel like some of these diseases that can be cured if doctors just really just work hard and harder at what they're doing. Like, I understand that in most cases you can't quite track a virus down, but there's some like alternative ways where you can work around it, use the genetics and all other medical incentives, and trying to understand how a particular virus or cancer or some type of carcinogen in your body, however, whatever the case may be, however it works, for you to come up with a cure and make this cure readily available for people across the world. Now, technology, in my opinion, there's like some positive and some negative impacts of technology in medicine. In the positive aspect, you can see like statistically, cancer rates have significantly decreased because of laser surgeries, chemotherapies, radiations, breast MRIs and mammographies, and as well as testicular cancer, colorectal cancers, and stuff like that. Surgeries and surgeries and technologies that are available now to lower the risk, the remission of the cancer, and possibly eliminate it completely. I feel like at that aspect, like doctors are working closer and closer towards coming up with a cure for cancer one day where people won't have to deal with having to see a cancer physician or trying to figure out, oh, is my cancer going to come back? Am I still at high risk of developing another cancer outside of the diagnosed cancer? Or, all in all, will this possibly lead to the person death? But on the negative side of it, you have some cancer surgeries that are invasive. They are particularly invasive to health. I have family, in my family personally, that were affected by cancer. I have aunts and long distant cousins or whoever that have been diagnosed with cancer, and they've shared stories with me about how they were being treated for their cancer, but the operation or the medical surgery that was performed on them ended up causing another health issue, which I didn't quite understand. If you are prescribing a particular surgery for that particular issue, that cancer or whatever the issue may have been with that particular individual, why is it that another problem arose from something that should have been quote unquote fixing the issue or making it better or making the cancer go away or whatever you want to call it? I just didn't quite understand that. It's just you spending all this money for alternatives and trying to make you better as a person and have better overall health, while all in all that the technology that's being proposed to you by these medical professionals is helping, but it's also negatively affecting you in the process. It's just like, why Do you go out of the way of going and getting health insurance, spending all this money, and just going out of your way to see this doctor for this particular issue if other issues can arise from it? Another example being the increasing of HIV/AIDS rates. Now, this particularly hits home for me because I have a close family member who years ago died from full-blown AIDS, and I've just seen the effects and toll that it takes on that person's body, and it's not pretty at all. And I feel like sometimes that these technologies, like these testings, um, the test itself, like, yes, it tests for the HIV in your body, but does it necessarily tell, like, how long it's been in your body? How long do you have to live? Or it's like a rough estimate of how the infection has taken an overall toll on that person's body. Another thing with the HIV test is sometimes that the test can be quite inconclusive. Results may show up positive, but the patient may be negative. Results may be negative and the patient may be positive, or results just may not be concluded because this virus may be dormant. Some recent technologies may not be as equipped to detect the virus at its earlier stages, and patients have to wait months or probably even years before the next checkup to really actually determine if they are infected, and by that time it may just be too late because the patient may have already progressed to latent stage of HIV and progressed to AIDS and may be developing AIDS-related complications from being infected with the disease. But I feel like personally, like medical technology, in my opinion, I feel like it has improved, but there are still a lot of key areas that need major work on. As far as like with alternatives for HIV, I feel like now recently that research has come up with a prescription drug called PrEP, pre-exposure prophylaxis, which is kind of a vaccine which prevents HIV infection. And I felt like that's a little, what can I say? That kind of raises skepticism for me, because if you can invent an entire regimen to prevent a disease, HIV, for example, if you can invent an entire regimen which prevents someone from being infected with the HIV virus, then you can't come up with a cure for it. You can invent and make all these alternatives that slow progression of the virus, and even a pill that you take once a day, 24 hours, once every 24 hours a day, and it just eliminates and lowers your chances of even being infected with the HIV virus. I honestly feel like that doctors are able to cure the disease if you can take that much time in inventing a pill regimen that completely just blocks the receptor, the virus from attaching a receptor on your T cell, the infected T cell, that you can come up with a way to completely obliterate the HIV. But all in all, I do feel like technology has spurred in many ways as far as cancer research, HIV/AIDS, and another important thing is medical records. Like with old-fashioned paper records, like information was being lost and patients were losing health coverage and not being able to register for like their upcoming doctoral visits. But now research has really improved, technology has really improved, where patients can now access their appointments and health information via the internet. But that's still not even a trustworthy service, because you have computer hackers who can hack into a clinic's database, a hospital database, and they can like literally have all the information in their hands and just do whatever they want with it. And it can't really be using it over the internet can be convenient as far as being able to see all the information over the internet and all that, but sometimes it can be put in the wrong hands and used for the wrong purposes. Well, that's the end of my video, and see you soon. Have a nice night.